Good morning, everyone. And I'm Dave Johnson. I just got the privilege of having Rick Deitsch as a friend. You've changed my life. Thank you. It was about 4 years ago where I actually heard your name. It was over 5 years ago that I was using your product, an earlier version of Cell Defender, and I was able to have a wonderful medical reprieve, I could say. And so it got me really excited about letting other people know about this important product. And here we are at just the most exciting moment. I think if you really look at your life, it's really fun to think that right now, here at this moment, is my favorite job I've ever had. Here's a chance to really be in my A game, to really do work that matters. And I think that would be an attractive thing to anybody, to just be here right now. This is that grand moment. And I believe when you listen to Rick and look at the backstory of what's going on here, that, wow, this could be your day, your turn to shine, to really make a big difference. But we hear a lot about products. I think a lot of us that come to Avini, we're already product enthusiasts and we're label readers, and we soon fall in love with all of this. And we've got quite a library of Rick Deitsch material. And our goal really, when I meet somebody, is get them to listen to something by you, and ideally turn anyone into a Rick Deitsch binge watcher. But so here's one more for our library. But if you could, okay, biochemists, there's not a whole lot of them. There is some, but you're at the top of your field. How did you become a biochemist? When did that thought first come into your mind?
Yeah, that's a long story. All right, so it's kind of weird to tell people, but I've always wanted to be a biochemist since I was a little kid. And there's two parts to the story. There's the first part, and then there's the thing that reinforced that idea. So the first thing is, I've told the story before. When I was a little kid, my father had cancer. My father had Hodgkin's disease. And now, if you get diagnosed early stage of Hodgkin's disease, it's incredibly treatable. It's incredibly, a lot of people get over it, but back then it was a death sentence. My father was in a clinical study at Temple University in Philadelphia, and I'm the youngest of five kids. So my mom at 33, 34 years old, towing five kids behind her, would go to visit my father in the hospital. And I say youngest, I have a twin brother. So me and my twin brother were the littlest. At the time, I think I might have been about 5 or 6 years old. And I remember my mother coming to the hospital to see my dad when he was going through his therapies. And the doctors were horrible. Every time my mother talked to a doctor, she would leave crying. They didn't really answer her questions. They were rude to her. They didn't, and even to a little kid, it seemed like they didn't really know what they were talking about. So this one day kind of sticks in my head. There's my mother, the five kids. We just seen my father with all the tubes and everything coming out of him being treated. And my mother just talked to a few physicians, and she was beside herself. She was really upset, sitting on a bench. And we look up, and the doctor that just upset my mother is being talked to by, if I saw them today, I'd call them hippies. You know, they were a couple of guys in white lab coats, long hair, ponytails. Remember, this is the early 70s, you know? So they look like a couple of hippies with clipboards, and they were yelling at the doctor. They were poking him in the chest. Clearly, they were in charge. And my mother asked the nurse who they were, and she said, "Oh, those are the biochemists from the University, Temple University College of Medicine. They're running the clinical study that your husband is on." So my mother went up to them and said who she was, and they were awesome. They sat down with us. They explained the drugs my father was on. They explained how they worked. They told my mother how great my father was doing and what to expect next as far as side effects and efficacy. And they were just awesome. And I'm thinking, wow, these guys made my mother feel better. They're fixing my father, and they were yelling at the doctor that upset my mother, you know? So to a little kid, it was a perfect storm, and said if I was going to do anything there, I was going to be those guys. They seem to know what they're talking about. So that's already in my head. But as I got older, I became a big comic book guy. And I don't want to get into what's better, DC or Marvel. I'm a Marvel guy, but I would read all these comics, and you won't believe how many superheroes were biochemists or other scientists, but usually biochemists that had accidents in their labs and got superpowers. So in my mind, that's me. I'm gonna be a superhero. I'm gonna have an accident in my lab, be a superhero. Whether I can shrink or grow or fly or turn invisible or whatever, somehow I'm gonna have an accident in my lab. And I actually wrote a paper in high school because it occurred to me that a lot of these superhero powers were somehow genetic mutations, and cancer itself is a genetic mutation. So I said, what are the possibilities that a cancer could be beneficial? That a cancer would do something that would actually give you some sort of heightened ability instead of just killing you, you know? And so I wrote a paper that said it was about 1 in a million, a little less than 1 in a million. And I said, wow, with the current US population and even the global population, that means right now there has to be at least a dozen people walking around that are superheroes somewhere in the world. So that's why I wanted to be a biochemist. I always did. I bounced around a lot after school. We didn't, my family wasn't poor, but we were lower middle class, certainly couldn't afford college. And so I didn't go to college right away. I did the community college and things like that. I bounced around the country. I had all sorts of different jobs. Eventually, I became a bartender. And I have to tell people, I give most of the credit for my success to my years as a bartender. It taught me how to deal with people, how to listen. It taught me empathy. I'll never forget one of the first days at one of the jobs I had, a woman came in and she was upset because her husband had just been killed. Her husband was a psychiatrist and was killed by one of his patients. And so she's beside herself. And then on the other side of the bar is a deaf guy that's trying to order. And I know very little sign language, but I knew a little bit of sign language. And I took his order and she's like, how can I feel sorry for myself when this guy can't even hear? And I put them together and they actually struck up a friendship at my bar from a guy with a disability and someone else with a tragedy. And I learned empathy. I learned how to deal with people. I learned from different social stratas. So a lot of my success is not just I'm a biochemist, but it's my years as a bartender, where I bartended my way through college and graduate school. But when
You excelled in bartending. Tell us a little bit about your notoriety.
I always believed that you do what you love to do and you do it to the best of your ability and everything else works out. So when I was a bartender, it wasn't enough to be a bartender. I had to be a really, really good bartender. And so I learned every drink. In fact, the last test I took, there were 4,500 drinks in the test. So I learned every drink. I learned every garnish. I learned every glass, all types of beer, all types of wine. And then part of it was I worked at the time, TGI Fridays, and we used to do a bartender competition where we flip bottles and tell jokes and be entertaining. And I actually went to the nationals. I was the Florida state champion, and I wound up to be the second on the East Coast, second bartender on the East Coast. So I was nationally recognized as one of those bartenders that did flair and flip bottles and did all that stuff. And I actually worked with, if you've ever seen the movie Cocktail, the guy who trained Tom Cruise for that movie was a bartender named JB Bandy. And he had a company called Show Tenders. And I actually worked with JB Bandy, who trained Tom Cruise for the movie.
Fascinating. So in your side time, you became a biochemist. So
yeah. Yeah. So I went to college and I always wanted to be a biochemist. So I majored in chemistry. And then I took neurochemistry and neuroscience as electives. Everyone thought I was insane taking neuroscience as an elective. But I knew that when I dove into chemistry, I was really interested in neurochemistry. How do the nerves affect everything? And it's true, the nerves absolutely affect everything. When you have diabetics that are losing circulation in their hands or feet, it is venal claudications, but a big chunk of that is the nerves themselves are damaged. When the nerves forget that there's tissue there, they stop feeding it. They stop giving blood flow to it. They stop giving oxygen to that tissue. And so it's all neurologic. And if you could have healthy nerves and healthy nerve function to feed your body, that's a big part of health and wellness. So I really wanted to dive into neurochemistry. And to that end, when I was first in undergraduate and then in graduate school, I discovered neurotoxins. Specifically, I was working with cone snails in college and graduate school. And I've described this before. Cone snails they're everywhere. There's over 500 living species of cone snails. We've discovered thousands of extinct species of cone snails. And this is my warning. If anyone scuba dives, if anyone goes in the ocean, if you see something that's really colorful and moves really slow, it's venomous. Don't go near it. If it's colorful, if it's attracting your attention and it can't run away, it's got something that can kill you by definition. Also in the ocean, by usually anything red is going to be venomous or poisonous. So you want to avoid anything red. But I study cone snails, and cone snails are really cool. They look conical. Do I have some cone snails? Shelves here. My wife moved everything around in my office. I thought I had some shells. I got a lot of stones. Got a lot of stones, no shells. I usually have a few cone snail shells around, but they're people have seen cone snails before. They're a conical shell, look triangular. But we would scuba dive right here in the Florida waters, and we'd catch cone snails, and then we'd extract the venom and test the venom for biologic activity. And that time, we actually discovered new species. I discovered what I thought was a Conus jaspidius, a jasper cone, but it was wrong. So we took it to a shell expert, and he said, you discovered a new species. If you can find another one, you get to name it. So the next time I went scuba diving, I specifically was looking for that, and I found a second one. So I got to name it. So I named it after my wife, Elizabeth, Conus elizabeth, the Elizabeth cone. So my wife has a venomous snail named after her, which is kind of cool. But the thing about cone snails is they basically sit on the bottom of the ocean. They stick out their tongue, and it looks like a worm. And when a fish gets close to eat the worm, it stabs it. It's got a radular tooth in the end of its proboscis. It stabs the fish, injects paralytic venom. Once the fish is paralyzed, it drags it in and eats it. And so, like I said, there's over 500 species. The cone snails around South Florida tend to be pretty small. Conus jaspidius is only about 1 to 2 centimeters, but it goes all the way up to the caracone. Conus daucus is about 6 centimeters. But you go out to the Indian Ocean or around Australia, you got giant cone snails, 60 centimeters, 70 centimeters. And in fact, the first cone snail drug, I actually worked on the early versions of it. It was originally called SNX-111. It was called ziconotide. Then Norex launched it, and they called it Prialt, Prialt. And that's an approved drug for treating pain from cone snail venom. And that comes from Conus geographus, which is a giant cone snail around Australia. The original venom was isolated from that. But in college, we used to milk the snails. It's really hard to milk a snail. Or if the snails were too small to milk, we actually had to sacrifice the snails. You had to kill it, take out the venom sacs, and scrape out the venom to get a few drops of venom to test. And I never wanted to kill anything. I felt terrible doing it. And when we milked the snails, we got very little venom. So I was studying something called alpha conotoxins. So they're toxins from cone snails that affect the nicotinic receptors. And I found out that cobras make alpha cobratoxin, which is very similar. But when you milk a cobra, you get a ton of venom from a cobra. Much, much more than a cone snail. And it doesn't hurt the cobra to milk it. It's actually very healthy for them. And I started looking at cobra venom. And even when I was in graduate school, still working on cone snails, I found a company in South Florida that was using cobra venom to treat multiple sclerosis. And I said, wow, that's awesome. So I started working with that company. And here's where it gets a little tricky. I really thought I was going to be one of those basement chemists. I was going to be working either for my own company or another company. I was going to be in the basement working on treating all diseases. I was going to cure cancer. I was going to cure viruses. I was going to do that. And then I met my wife, and my wife has expensive tastes, and I realized I had to make some money. I couldn't just be a chemist and throw myself into the work and be in academia. I had to actually get a job and make some money. I started doing some consulting work because the work I was doing at Florida Atlantic University and then also working for Duke University was something called computer adaptive drug design. I would model these peptides, these complex proteins on a computer, and then match it up against potential receptors. How did it work? Why did it work? How could it possibly work? And to that end, some of the work I was doing at Duke University, they were looking at something called camptothecin for treating cancer. And camptothecin comes from a bush, the Camptotheca acuminata. And it gets complicated how it works, but it's something called a topoisomerase 1 inhibitor. It stops cell replication. When your cell's trying to copy DNA and divide, it stops it from happening. So that's the way it treats cancer. It worked in every animal model. Every animal model, we gave rats camptothecin and it cured their cancer. When we gave it to humans, it killed the humans. Like, okay, so we discovered two things. One is that humans aren't rats, at least not all of them. And we found out that there was something happening that was hurting humans but not hurting rats. And we found out later, if you look at the structure of the camptothecin, the very end is something called a lactam ring. And it opens up in an acidic environment, and that activates the drug, that activates the compound. And cancer is a highly acidic environment. So we'll go to the cancer and open up and it will kill the cancer. The problem is that there's other acidic environments in the body. So we were finding that it was getting into humans' kidneys and bladders and destroying the kidneys and bladder. So why was it doing that? It was actually attaching to something called human serum albumin, which is a transport protein in our blood. So these human serum albumin was sucking up the drug, bringing it to the kidneys and bladder, dropping it off and destroying the kidneys and bladder of the human patients. It did not bind to rat serum albumin, but it bound to human serum albumin. And that was the problem. So my job was to model it on a computer and find out why was it binding to the human serum albumin, and could we do something about it? So we started making analogs to that drug, to camptothecin. And some of the analogs are actually approved drugs today, irinotecan, topotecan, and then one version that was in study was 5-hydroxy-7-methoxycamptothecin. And in essence, we attach things to the main drug to prevent it from binding to the albumin. So it wouldn't bind to the albumin and then could get to the cancer and kill the cancer. So that was work I did at Duke University Comprehensive Cancer Center. But because I was doing that computer adaptive drug design, there weren't a lot of people doing that at the time. It was highly specialized. There might have been 200 people in the world doing what I was doing. So I found that I had a niche that I could use to create a consulting business. So I created a consulting business where I was working for a bunch of different pharmaceutical companies and even academia, making these computer models and doing these molecular dynamic simulations where I model the molecule in a computer and see how it moves, how it works, even sometimes what it looks like. And this is actually really fascinating too. How do you know what a molecule looks like? And so there's two basic mechanisms of getting molecular structure. One is NMR, nuclear magnetic resonance, and one is X-ray diffraction. So with X-ray diffraction, they make a crystal of it and they bounce X-rays off of it and they get a model of it. We found with X-ray diffraction, though, a lot of things that are normally in solution don't look the same when they're dried out. So if I took a human, I dried him all out, he'd look like a zombie. He wouldn't look like him. On the flip side, NMR is in solution. So when you take an NMR image, it's not necessarily true either. Like, Dave, if I took a picture of you swimming in a pool, is that what you look like? You're going like this in the pool. Is that really what you look like? No, you're all akimbo. So what we used to do is take the X-ray structure and the NMR structure, and we'd create a dynamic pathway between the two structures. Somewhere between the two is what it really looks like. And we'd find its lowest energy structure, and that's what it really looks like. And so that's kind of what I did in graduate school. And it was kind of cool. You know, I take molecules that they swore that's what it looked like. I'm like, no, it actually looks like this. And once you understand what it looks like, you can understand what it binds to, how it works, how it functions, how to change it if you need to change it. I know I'm doing a deep dive into this stuff. It has nothing to do with this. But the point is, I was doing some consulting, but I was still also bartending at night. And I actually met the president of Rexall Showcase International at the bar I was bartending at.
Oh,
okay. So this is a guy named Dave Schofield. He was a regular bar customer of mine, and he loved it. He would actually bring products and ask me to review the products for Rexall Showcase as I was a bartender. And it was at his 40th birthday party. He invited me and my wife to attend his 40th birthday party. And he turned to the head of HR and said, "You got to hire this guy." He goes, "To do what?" He goes, "I don't care. I want him working for us." And that's how I wound up at Rexall. Dave Schofield, the president of Rexall Showcase at the time, was doing about $200 million a year in sales. He wanted me to work there. So my first job at Rexall was, I can only describe it as shell answer man. My job was to answer distributor questions when it came to the products. That was my first job. And it was terrible because the person who had the job before me was supposedly a naturopath, but she had a lot of incorrect answers. I started going through like her frequently asked question database, and most of it was wrong and was not founded in science. It didn't make a lot of sense. And so my job was difficult because the distributors at the time had been miseducated or undereducated. And I took a lot of time rewriting the database, doing frequently asked questions and all the products. And while I was doing that, they were using me in product development to make new products. So here I am, a guy that designs drugs, And now they want me to design vitamins, minerals, dietary supplements. And I have to tell you, I was a jerk. I was a little bit of a jerk back then because I was a real scientist and I'm surrounded by these ponytail guys. I called them herbal gerbils, all the herbal gerbils who really didn't understand science. I'm a real scientist. Who are these guys? And I'm going to apologize now because some of them have become really good friends of mine. They're giants in the industry, teaching at major universities, running major organizations. These were smart people. And I learned to respect them at my time at Rexall because I was now interacting with them, doing clinical research, designing new products. And it was a lot of fun. And so I got to design at that time at Rexall Showcase, which eventually became Unicity. We were part of Royal Numico. We had 400 PhD scientists working with us. I got to design over 50 different dietary supplements. I did over 50 clinical studies with those supplements. We created dozens and dozens of patents on new formulations, compositions, methods of use. And I did a calculation by the time it was like 2003, when I was finally working on my own stuff apart from the Rexall families. I calculated the sales of just the products I had created at Rexall, and it was several $1 billion in sales. And I'm thinking, wow, I really should do this for myself. And so that's where in 2003, 2004, I kind of did a couple things. First of all, in 2003, I got approached by some of the people that I worked on Cobra Venom with. And they were running a new company, NutraPharma, and they asked me to come in and run NutraPharma. And that was a public biotechnology company that just bought a bunch of intellectual property on using Cobra Venom to treat disease. And for me, it was like coming home. This is stuff I had worked on 8 years before, and I was going to get to do it again. So since then, NutraPharma now has 21 patents. We have drugs for the treatment of pain. We're furthest along with multiple sclerosis. We've treated over 300 patients with MS. And we have orphan designation for pediatric MS. So we're moving to phase 2 studies this year for multiple sclerosis. We also have new intellectual property for Lou Gehrig's disease, ALS, and we have antiviral drugs. It's kind of weird. I was really focused on hepatitis C because up to about 5 years ago, there wasn't even a treatment for hepatitis C. So I said, we got to do something about this. And it went from not even being treatable to now being completely curable in the last few years. So now it went from you can't even treat this thing to now I have a cure. You have to be on this drug for 3 months and you're cured, which is absolutely amazing. That's one of the things I was working on that I don't have to work on anymore because they've cured the thing. But I am doing that work with NutraPharma. That was around 2003. I took over NutraPharma and have grown it since. But I also founded Wellness Industries, eventually became MGRD. That's my wellness company. And then Pure Raw Supplies is my formulation company. And over the years, we've formulated a bunch of different dietary supplements. I've worked with a bunch of different companies, but I suffered, just like we talk about, network marketing PTSD. Every time I worked with a network marketing company, through no fault of mine, through no fault of my products, something really bad happened in that company. And it was usually the owners or the management. My first product, my first zeolite product, I made that company millions and millions and millions of dollars, and they treated me very badly. And they really went out of their way to try to minimize my products and have other products, which made no sense because they made a lot of money on my products and it helped a lot of people. But eventually I had to sue them to get the rights back to my own products. And I did. I successfully sued them in federal court. And in 2018, got all the rights back to my stuff. And at that time, I was making some products. I was making coffee products for another company. But I wanted to relaunch my zeolite. And we finally did in 2020 that you're familiar with. And again, not my fault that the company failed. The founder of the company got indicted and that went away. We brought it to another company. We brought it to another company. That company got sold. So it happened over and over and over again. And my longtime partner, I've worked with Neil Roth for over 20 years. He was a distributor at Rexall. We created a couple of companies ourselves in the early 2000s. So Neil has been a partner of mine for over 20 years. And he said, let's just make our own company. And I said, absolutely not. That's a lot of work. I don't have time for that. I can't do it. Let's just make a product and we'll sell it to someone else and it's their problem. And he actually logically sat down with me and my wife. He actually convinced my wife that if we're the owners and we're the management, it fixes everything. Because the products have never been the issue. The products and science have never been the issue. They're unimpeachable. but we always have problems with the management and the ownership. So if we're the owners and the managers, we have a winning solution. And my wife convinced me when we first started this in March of 22. We started a few months of an affiliateship and officially launched May 1st. I still didn't want to do it. And then I saw us take off, and it's a big hand to you and the distributors you brought in and the original group that come in from some of the other companies. I actually didn't think we could do it. And now we are growing month over month. We're debt free. We just moved into our 18,500 square foot facility. It's unbelievable. The growth is unbelievable. We keep having to hire people and bring in more stuff. And it's turned into a real major company that has the potential to be one of the biggest in MLM. And it's doing what I wanted to do from the very beginning. When I first launched my zeolite, I said, this is a staple ingredient that can be in other products. It doesn't have to stand by itself. And like, I used melaleuca as an example. They put melaleuca oil in everything, which sometimes I think is hilarious. It's this amazing product, this tea tree oil. It cures all disease, and you can wash your clothes with it. It's absolutely amazing. And so I feel the zeolite fits that mold. The zeolite can be in anything. It can be in personal care products. It can be in dietary supplements, and it can stand on its own because we know the benefits it provides. And so that's what I want to do. So if you look at our product line, every product except for the nano silver, which is a standalone product, the nano silver, all the other products have the zeolite in it. And there's a reason for that. And so I want to do what Melaleuca did for Melaleuca, which is now a multi-billion-dollar company. I'd like to do for Avenie. We could be the zeolite company. And I think we're well on our way to do it. I don't know if I skipped too many steps because a lot has happened over the years, but what's really it comes down to is I'm still a pharmaceutical biochemist working on drugs for the treatment of disease and running Nutrapharma Corporation. And I'm a nutritional biochemist where now I'm the chief scientific officer of Avini Health, making what I think are the best products in the industry.
Oh, that's amazing. I'm just looking back. This April will be my 48th anniversary in network marketing. So
oh, wow.
we've been married 51 years, so I've drugged Valerie through quite a few things. But I'm just looking back, and all of those times I've given my heart to 8 different companies. And every time I've started over, all the people I've built, basically it was, that's enough for me. I'm done. And we had to just start all over with new people. But when I first discovered what you have, it feels like I came to the dance with you 4 years ago, and a lot of us did, and a lot of people having Avini when it started not quite 2 years ago it feels like a family reunion, because I look at this right here. I've used this for 5 years now with 4 different labels, and the thing that's interesting is that we've followed as a group. Pretty much when those other companies failed, we understood it wasn't you, it wasn't the product, it was the owner. And we just thought, okay, we found a new ship. Everybody keep your same seating assignment. And it's just been quite a testament that we've got something here. And it was frustrating, but going through that circuitous journey, it's been so worth it, because here we have a company that is trustworthy and competent, and just, wow, the best there is. So
and we care. Rexall Showcase was my first MLM that I worked with, and I think it ruined me. It really did, because we, first of all, over 30% of our distributors were medical professionals, so we were very high end. We cared about the research, we cared about the products, and we really were like a family. And when it all flew apart, it was really like breaking up. It was like a divorce. It was like breaking up a family. Which is why I'm so thrilled now that I look around at our conferences and I see people that I worked with at Rexall, those over 20 years ago. So we had the Rexall people, we had the Wayora people, Unicity people, Navan people, Amplify people, like all the people we've touched over the years have now come together. And you're right, it's like getting the band back together. And we like distributors. I actually like distributors. They're amazing. I think there was a distributor at Rexall, Dr. Neil Seacrest, and he was amazing. And he had this great quote. He said, the best things and worst things of network marketing. The best thing about network marketing is the distributors are a volunteer army, and they'll kill themselves to get your message out there. The worst thing about network marketing is the distributors are a volunteer army and they can quit anytime they want. It's the best and worst. So that's why you have to realize the distributors are the asset. The products are great. The products are a great vehicle and we're helping a lot of people, but the distributors are the number one asset of the company. So we have the right distributors. It's unbelievable what we can accomplish. And also, when we make decisions, we think about distributors first. And I'll go back to a Unicity story, a little anecdote. Back then, they wanted to start this new program. They were going to do, they called it, what do they call it? Like city bombing or city, like the city explosion. They would pick one city and they were going to advertise in that city, radio, television, newspapers, everything local. And they were going to rent a local stadium and bring in thousands of people and then do a meeting. Right. And the whole idea was that it's a way to just explode that city by getting as many people in that weren't distributors as possible. And then anyone that signed up, they distribute among the distributors in that city that donated, that paid for that meeting. Right. And I said, okay, let's talk about this. How expensive is that going to be? Oh, it's going to cost millions of dollars. Well, who's going to pay for it? The distributors are going to pay for it. Well, through all the last iterations, the distributors are now making less than they've ever made. They're making less and less and less. They were having a real crisis of faith at the company. And now you're going to tell them they're going to pay for this? They're not going to pay for this. It's not going to happen, you know? And to do this kind of like just scattershot approach, you've never tested this. At least you got to test it first. So my first question is, how is this going to affect the distributors? I asked that question. And the head of the company turned to the rest of the board and said, that's a good question. How is this going to affect the distributors? I'm like, that shouldn't be your last question. That should be the first question. The first thing you do when you're making any decision is say, how is this going to affect my volunteer army? You know, and is it going to engage them? Is it going to increase their belief? Is it going to make them want to go out and spread our message? Or is it going to make them want to quit? Because it's that easy. And so the whole idea is that we want everybody engaged. How do we make everybody engaged, make everyone feel their sense of ownership and belonging? And of course, it helps that our products are life-changing, that they've been known so many people that are even alive today because of our products and our technology. So that helps a lot too. And that gives you staying power when people want to use the products. So even if you have some hiccups on the management side, people want to use your products, it gives you a little bit of staying power, you know?
Yeah, absolutely. I just think the ideal business is to have something that's powerful, that's life-changing, and that's affordable so somebody can buy it. And when they buy it, they feel a change in their life. And so they want to keep using it. And then ideally it's consumable, so they'll want to order more. So you don't have to keep looking for new customers. Just love the people you already have and give them good stuff that changes their life. And then ideally power that with a good auto ship so that encourages them all the more. And then it's so good they'll refer other people because every business loves referrals. And then just have a really good compensation plan so that you can do what we naturally do anyway, because that's inside all of us, is if we really believe in something, we'll want to share it with the people that we love, and then just make that the prime directive. And oh, here we are. And so it just,
Exactly.
I love what we're doing.
And people, I love as a scientist, when I make a product, normally you make a product, you're in the back, it goes out into the world. You don't know, you go like this and you don't know what happens. I'm on the front lines. First of all, I get to educate everyone on the products, how they work and why you want to use it. And then I get to see the final consumer, how they're benefiting from the work I'm doing, which is unbelievable. This normally, when you have a product, it goes out there, you have a store shelf behind it. With our product, you have a person behind it. You know, that's one of the reasons I love network marketing, because every product has a person behind it that's going to make sure you're doing the right thing. Now, I will say at the very beginning, you talked about replication. You talked about a little bit about who I am. And I do warn people about this whole concept of analysis paralysis. So many people want to know everything about all the products that they don't share it until they learn more and more and more about it. So that's why I want to make sure that you go to the back office, there's white papers, there's published clinical studies, there's all this stuff so that you know it's there. So you don't have to be me. You don't have to have a PhD in Cell Defender to be able to share it with people. It's safe, it could be highly effective. Get as many people on it as possible because you're going to save lives.
You're absolutely right. And the whole thing to be duplicable, you want it to be simple. And ever since back in the 70s when I was in Amway, it was a cassette. And I built my business with, what got me in was listening to a cassette tape. And what kept me in was listening to cassette tapes. And then I used that as a model thereafter. And when I first met you, I made a little recording. But now with modern technology, the same plan is just my job is to just go out and get people curious enough to listen to a little presentation with you. And then their job is to decide. And so it's something real simple. You do your story, and I just get people to listen to the story. And so and then teaching other people to do that works really well.
It's going to get better because I apologize. Just the way the company is put together and the growth of the companies, I've been so busy just making product, buying equipment, validating equipment, moving into the new facility, that I've been so busy doing just working that I haven't been able to do what really the company needs, which is content creation, meetings, Zoom calls like this, because that's what's going to drive growth. And so we are at the point now where we've hired so many more people. We've gotten equipment in to automate everything. So for example, when we used to fill liquids, we had like one small liquid filling line that did a couple of bottles at a time, and it worked. We could do a couple thousand bottles in a couple of days. But now we have a circular liquid filling line. The other day, we filled 3,600 bottles of Cell Defender in less than 3 hours. So we're now at this point where it's getting better and better and more efficient. It's going to allow me to do the best thing for the company, which is clinical research, content creation, and meetings to try to get out there and make sure everyone's educated.
Well, the timing's right. The product is unsurpassed. The opportunity is yours. We are at the right place at the right time. And I think we ought to go for it.
And I'll tell